help with any questions you have about your Medicare, about your insurance, your health insurance, your auto insurance, your homeowners. We're a state agency. We do not sell insurance, but we have a large staff of people that are here to help you, the Oklahoma consumer. We make sure that insurance companies do what they say they'll do. And if you have any questions about a claim or a denial, I just wanted to make sure I reiterated that you can call us at any time. Our website is oid.ok.gov. Again, that's oid.ok.gov. So we're here to help with that. But today we're going to talk about Medicare and COVID-19. And we've got a couple presenters. Before I get into that, I wanted to let you know that during today's webinar, you'll be able to see and hear the presenters, but you won't be able to ask a question verbally. We do have a chat box at the bottom of your screen. On my screen, it's on the bottom right. You can leave any kind of question that you have for either presenter there, and then we will do Q&A at the end. If you want to send it directly to me, you are welcome to. I'm probably under OID, and I'll say hello in a moment, or you can ask it so everybody can see. So we'll get to your questions at the end. And also, if you have any technical problems, please put them there and I'll do my best to help. Okay, today's speakers are Ray Walker, Divisional Director for the Medicare Assistance Program at the Oklahoma Insurance Department. Ray has more than 20 years of experience working in and around the healthcare industry, primarily in insurance. Ray currently serves on the advisory committee to the State Council on Aging and recently completed his second term on the Senior Health Insurance Assistance Program Steering Committee, where he served as vice chair for the SHIP Steering Committee, as well as the Leadership Council for the MIPA Grant Program. Our other speaker will be Gaye Humphrey, who is the outreach specialist for the Centers for Medicare and Medicaid Services of Dallas. Gaye has more than 15 years experience as a subject matter expert on Medicare program benefits. Gaye serves on the Medicare National Training Program workgroup. She is going to kick us off today. And so Gaye, if you will share your presentation, we'll turn it over to you.
All right, give me just a second here and I will share that presentation. All right, everyone. Good morning, and thank you for being part of our presentation today. I wish I could see you all. This has been the hardest thing for me during COVID, is trying to work with people when I can't see them face to face. So just know I'm smiling at you, and I'm just so glad that you're here. And again, we will have a Q&A session at the end. And during this session, while we're talking about COVID and Medicare, you can send those chat questions, and we will make sure that we get to all of those that are asked of us. So I'm going to go ahead and advance the slides now, and we'll talk a little bit about COVID-19. I hope you've heard about it before, but that was a little joke. We're just going to talk a bit about how does Medicare, what are the guidelines Medicare uses, and how does Medicare help to take care of folks during this time? Oh, that's not good. Let me. Okay. There we go. All right. Now then, we know that as we've gone through this past year, there have been some changes to attitudes and ideas about the best way to handle the COVID crisis or pandemic. But we know that there are just some things that have not changed, and they're probably not going to change for a good long while. The first one is, if you are away from your home and you're out and around other people, wear a mask. A cloth mask over your nose and mouth is one of the best ways to keep you safe and not catch the disease from someone else, or to spread it unintentionally, of course. So the mask. And the second thing is wait. If you are standing in a crowd, in a line at the airport, it doesn't matter where you are, Unfortunately, a lot of places have little X's on the floor, out of some colored tape or something like that, 6 feet apart. We just have to avoid close contact with people we don't know, because, anything could happen. We know that to be true. And then, of course, the third thing is wash your hands or use hand sanitizer. These are the 3 most effective ways, really, to keep down the spread of COVID-19. And those have not changed since the pandemic first started, and we just anticipate that they'll go on for a while. Next slide then. All right. All right, now we do have information for older adults that says that are high risk. You see here that 8 out of 10 of the deaths reported have been in adults 65 years and older. So if you need some other information on how to reduce your risk of getting sick, CMS and the Centers for Disease Control, the CDC, are partnering in this messaging. And you see the link down at the bottom, cdc.gov/coronavirus. And you can go there and, especially if, things kind of get a little bit lax with our meetings and gatherings of people, you might want to go there and just look at what are the best things we can do in order to keep everybody safe as we continue through this. All right. 4 in 10 United States adults have reported saying, yeah, I probably should have gone to the doctor for that, but I just didn't want to because, I don't want to get sick with something else while I'm there. And I just don't want, especially to run into somebody that might be there and not know they have COVID. So, of course, it was urgent or emergency care. Really, the delays in that were more common among people with disabilities. And so we see here someone in a wheelchair or has hearing issues or vision issues. And then people with 2 or more underlying conditions. That does throw them right into a very high risk situation in a time like this. So those folks were more careful about going to the emergency room or to an urgent care center during this time. Now, telehealth, of course, has just expanded so much through COVID-19, and telehealth has been able to help people get the care they need through a telehealth visit. So you see here that even during the pandemic, it's saying to us that people who experience an emergency absolutely should go to the emergency room to seek care. We know that our hospitals, emergency departments have done a really great job of isolating folks that come in with any kind of symptoms for COVID. So, many of our hospitals have COVID units. Emergency room has COVID beds that, all of that is cordoned off from where the general public would be. And so if you need urgent care and you need to encourage others that if you've got an emergency, go ahead, go to the hospital. Don't risk your life trying to stay out of the hospital when you really should be there. All right. And of course, preventive services. We know that Medicare does pay for our preventive services, but we see that they have also declined during the pandemic. So we don't want to ignore symptoms or delay care, which is what we just talked about. And we know that many preventive services are free to people with Medicare. And actually other insurance as well has followed that lead on several of the preventive services, at least with copays or deductibles charged for the preventive screenings. So, but for people with Medicare, many screenings are free, and it's important to stay healthy and stay on top of these regular scheduled screenings in order for us to continue to stay healthy and not end up in the hospital with something more serious because we didn't do the preventive services. All right, what's happened here again? There we go. All right, now then we know that telehealth has expanded a lot. And some of the ways that Medicare was able to change policy. And we did this through what we called waivers. That means that policy has changed for a specific time. And then at the end of that time, those things might return back to how they were before. But during the pandemic, these waivers have allowed for a much expanded telehealth experience. And what we're seeing is reports of people and physicians and those policy makers looking at, are there some of these we really need to keep once things settle down, the pandemic is over? Can we keep an expanded way of using telehealth in order to reach more people effectively? One of the things they did was allow more patient locations, including your home. A patient could be treated for an illness that typically would have put them in the hospital, but there are areas who use telehealth and home visits as well to take care of folks. And we did see some certainly unusual use of spaces. We know that in many of our hospitals that were so overcrowded, the cafeteria became a patient ward and they had patient beds there. Or, the ships, you remember the ships that pulled into port on the East Coast, and then I believe some on the West Coast as well, to be there as another opportunity to have beds and emergency care for folks who were coming in with COVID. Doctors can practice across state lines. So what this means is, and this is kind of an extreme use of this, but if a person, let's say, was a patient at the Mayo Clinic and they're well enough to go home, but they still need to be in contact with their doctor and have, some medical services, that doctor can practice across state lines then to take care of the patients rather than the patient having to travel to where the doctor is. That's one way that could be used. And here it's saying that practitioners can see established and new patients. So practitioners can, it's not saying they have to, but they can see folks that they've not seen before, as well as their established patients. So what we did was just expand the opportunity for people to be able to get the care that they needed through telehealth. All right. COVID-19 tests. We know that Medicare Part B covers COVID-19 tests. It's an outpatient procedure. You pay nothing if you get it in a laboratory or pharmacy or from your doctor or hospital when Medicare covers this in the local area. So you know that if you've been in some locations, we'll see a tent on a parking lot, and it'll say, get your COVID-19 test here, and you can just drive in and do that just right at that site. And in some cases, qualified medical personnel can even collect your specimen in your home for that COVID-19 test. The first one that a person receives, the first COVID-19 test, without a physician's order. You could go anywhere that was giving those tests and just say, I'm here to have a COVID-19 test. But if you're going to have additional tests, then you have to have a doctor's order for that. And I've heard of people, and probably you have too, who went every day to have, a COVID-19 test. And so you have to have a doctor's order proving that is necessary to have them that often. Now, if we look at our Medicare Advantage plans, which we know we have many in Oklahoma that are Medicare Advantage plans, they can't charge copayments or deductibles or clinical lab tests to detect or diagnose COVID-19. So the Advantage plans cannot do that. And Original Medicare can do that Original Medicare, there would be no cost to you. I'm sorry, I misstated that. But you would have to have still that doctor's order for an additional test past the first one. All right. So we know that Medicare added as a Part B preventive service COVID-19 with no deductible. And you see that Medicare Advantage plan members pay nothing for the test, no copay or deductible. Medicaid must provide vaccine administration, so it's not just Medicare who is offering these services to folks at no cost to them. The vaccines, most private insurers cover the vaccines in and out of network. So that's something kind of out of the ordinary for most private insurers. If your doctor that you're going to for a vaccine doesn't really participate in your insurance plan, um, from most things you would have to pay a higher amount. But with insurers and the COVID-19, well, they don't have to, they would not have a cost if you're out of network. Now, this is really great, this last statement. And you may have heard this and you may not, but folks who are uninsured, what do doctors and facilities and camps on the sidewalk and all those places, what do they do about people who are uninsured and they don't have any coverage for them personally? And you see here that we call this HRSA, the Health Resources and Services Administration, has a program where they reimburse the medical facility or practitioner for the vaccine administration for uninsured and underinsured, those people who have just, let's say, emergency care insurance, something like that. So they would be underinsured for preventive services. And so that would be another group that HRSA would pay for. Right. Now then, how is it that USDA was able to get some vaccines approved as quickly as they were? And you see here we're going to talk about emergency use or authorization, EUA, and the safety of the vaccines. So here's what this really includes. The chemistry, manufacturing, and controls information for the vaccine. They have data to ensure the quality and consistency of the vaccine, records, site visits, and previous compliance history to assess compliance with good manufacturing practices. So they have these three data sources then about tests that have been run on these vaccines. And so for an EUA, remember emergency use authorization, you'd have to have an FDA, Federal Department of Agriculture determination that the vaccine's benefits outweigh the risks that might come with it on at least one well-designed phase 3 clinical trial. So, you know, the clinical trials would be more demanding the higher the number of phase 3. So we want to make sure that people are aware that these are not vaccines that somebody just cooked up in the bathroom at home. These are vaccines that have been tested and their effectiveness has been proved to be stronger and outweigh the risks that could come with that. All right. Right now, one of our main emphasis that we're talking about is vaccine hesitancy. You know, people are just hesitant, and we know that we've seen this with our children for years, that there have been, there's always parents who say, I just don't want my child to get a particular vaccine, or measles or mumps or, whatever. People just feel like that. Some people feel like that it's not safe for their child or something like that. So that's a vaccine hesitancy. And, that's kind of how parents voice their concerns. But then when we look at adults who have vaccine hesitancy, what are we talking about? We see that it could vary across the region. It could vary across demographics, different races, ages, urban versus rural, etc., may have different reasons that they're hesitant about the vaccine. So, and for some people, it's a hesitancy for all vaccines, or for some others, it may just be for certain vaccines. People think the risks are overstated, that not that many people are dying. They're just making a big deal out of this. Um, and so that's their mindset about that. And so they think that those risks, people are panicking when they shouldn't be panicking, for example. We know that it's a personal choice, but then we also know that we are part of a public and we have a responsibility for public health. And so that's, an issue that people weigh heavily. Um, I want to make sure that my personal choice certainly is what I do, and not looking sometimes at the public health responsibility or feeling like that's something that should sway their decision. And I've heard this next one a lot. Well, I'm going to wait and see, what happens with my friends who get this vaccine before I go and get mine. So I'm just going to hold back and wait and see what the results are from these vaccines. And then for some people, they just don't trust the healthcare system. My great uncle went to the doctor and got a vaccine for something, and he ended up, he died. Well, and sometimes that does happen, but that doesn't happen in every case. And some people who have had a bad experience, who maybe have not had a good experience with a provider, something like that, they just are not trusting with the healthcare system. And so those are hard hesitancies for us to address and be able to discuss with people. And yet we know that we really want to make sure that people understand the safety and the effectiveness of the vaccines. All right. So how do we overcome this? How do we talk to people who have these? And maybe you are one of those people and you're just listening today to hear what we have to say about this. So the number one thing is check your resources. Where are you getting the information that this vaccine is not safe, or is not, it came out too fast and we don't know about it? There are accurate resources everywhere for information. A good clue is, when you look at especially a website, you want to look at where that information came from. And so, you might look at the website, and if it has an email address or a web address and then .gov, well, that's the government website. Dot, BCBS, Blue Cross Blue Shield, maybe, something like that. You want to make sure that your sources are accurate. We need to have trust in the public health messengers across all communities. So that could be your own trusted medical providers that you see, local public health departments. Look at messaging for Medicare, the CDC, and the FDA, and knowing that they're going to be providing for you the most accurate information possible about the resources and the vaccines. One thing that's happening now that has just begun in the past probably 2 weeks is a system has been set up where people are volunteering to be like a messenger to their peers. We're talking ethnic groups, having folks who have had the vaccine who are saying, I'll speak to my people. I will encourage those that I know to, tell them of my positive experience and encourage them to get the vaccine. We've done, a lot of work towards this, and, people trust the people they know, and, are willing to listen to them. Someone can come on the TV or something, and there are a lot of people who will believe that regardless, but people are more apt to trust someone with whom they have a positive relationship already. Another barrier for people for just about most things is going to be access to the vaccine, and then also the cost. And we know that we have access across the nation, and in there are some areas, especially our more rural areas, where access is not as prolific as it would be in a big urban center. but we do have access across our states. The states are deciding how they want to distribute the vaccine, what are the groups that they're going to use, to not ration the vaccine, but to just make sure that they are dealing with a manageable number of people in the right order, to address those who have the most urgent need for it first. We know there's no cost, so no one is out of pocket any money to receive the COVID vaccine. And then again, the accurate information. That's the best way to help people see, the importance of the vaccine and help with their hesitancy to get it. So you may run across somebody who just has said, I'm just afraid of it. I'm not going to do that. And if you've had a good positive experience, then you can be one of our messengers too, to encourage people, with of course, the accurate messaging that we have, to feel better about the vaccine and realize, in many cases, this could be life-saving for someone to go ahead and get a vaccine. All right, we have 8 things to know about COVID-19, the vaccine. So here are numbers 1 and 2. Number 1 is the safety of these vaccines is the top priority. We know that there probably will always be some person who has an allergic reaction that made that person didn't even realize that they were allergic to what might be in the vaccine. Those things happen occasionally. The safety is a top priority. That's why they do all of the trial runs with this medication and with the vaccine, is to test it on all kinds of diverse groups to see what are some of the reactions to this medication that we're seeing, and how do we help people to understand, how they can be the safest about it. We know that COVID-19 vaccination will help prevent you from getting the virus. We know Moderna and Pfizer both require 2 doses. The Johnson & Johnson vaccine only requires 1 dose, but they all have been approved for use in the United States and are all being used across the nation. So here's a website for you at the bottom that talks about these 8 things to know about the vaccine. Let's go to the next page and see what we have. All right. CDC is making recommendations for who should get COVID-19 vaccine first when the supplies are limited. And we know at the beginning, when we started getting the supply of vaccines, we didn't get the whole 1 million or 2 million that we thought would be coming to Texas, for example. We had a lot of people in Texas who needed the vaccination. So how do we do that? Well, the CDC is making recommendations. These are not rules, they're not laws. They're just recommendations for the best way to look at, folks' need for the urgency of their need for the vaccination. Now, right now, we have a limited supply, but more is happening, more is being produced and coming in the current months and then to come. We will continue to see more of a supply of the vaccine as it gets created and in the labs and sent to us. Now, some people may have some side effects after the COVID-19 vaccination. I've had both of mine, and really the only side effect I had was my arm hurt. It was, that was kind of powerful medication that went in there, and it made my arm sore. I did not have any other side effects. I've heard of other people having more severe side effects that lasted about 24 hours, 12 to 24 hours usually. It's normal for your body to build protection against what we're vaccinating you for, and so you may have some kind of a side effect like that. Of course, always if it's a severe reaction, then you'd want to make sure and get in touch with your healthcare provider and let them know of that. There may be some kind of medication that they can give you to offset the problems that you're having, but it's not meaning that the vaccine is not going to work for you, or that everyone around you will have the same reaction. So we just want to help people to know that it could happen. It's normal if it does. Don't panic. And, but also be sure to see a healthcare provider or talk to one if you are having a reaction that to you seems more severe. All right. Cost isn't an obstacle. Well, we've said that before. People don't have to worry about how am I going to pay for this. Now then, we have talked about the emergency use authorization from the FDA. We know that at this time, many other vaccines are still being developed and tested to see if they might also join in to helping worldwide to deal with the pandemic through the vaccinations. And we know that the vaccines are one of many important tools that we use to help stop this pandemic. You remember our very first slide? You need to wear your mask, you need to wash your hands, you need to wait 6 feet distance from someone else. Those are probably the best tools that we know of for people to use. The vaccinations then certainly go along with that as well. All right. Now let's talk just for a few minutes about nursing home visitation and guidance, because we know that for folks who had family members and loved ones in a nursing home, this has been just almost excruciating, not being able to go in and check on their loved one and give them that hug that person, both people really have just missed and really need. So let's look at what the guidance now is saying about nursing home visitation. All right, now then, the decisions that are made about the guidance, of course, include state and local health officials and nursing home leadership. They're looking at several important factors. What's the case status in the community? Have the cases been a number of cases gone down, or are we right in the middle of a really hot spot? What's the case status in the nursing home? Because of course we don't want to submit people coming in from the outside to what's going on in the nursing home. We don't want them to bring it in to our nursing homes either. Is there adequate staffing at the nursing home to make sure that folks are being taken care of, that all of the safety precautions and the cleanliness of the facility is being attended to? Access to adequate testing. Are our nursing homes providing adequate testing as well? So those are really important considerations for the visitation in the nursing home. Now then, CMS recognizes, we've all recognized this, that it's just taken a huge emotional toll being separated from family and other loved ones. Folks in a nursing home, on a good day, many of them experience isolation and some anxiety, some depression, maybe some distress or confusion. And so, of course, being separated from our loved ones, and especially, I have a friend who had not seen her mother for 14 months in a nursing home. That's too long. For most people, 14 days is a long time. And so we want to just certainly address this and make sure that we're taking care of our loved ones and ourselves as we're looking at this. All right. So the guidance has some preferences. Again, these are not laws, but they are preferences. Outdoor visits, are possible, are probably best when it's possible to do that. And of course, we'd want to socially distance as best we can with those. Nursing homes allow indoor visitation if it's been 14 days since the last onset COVID-19. Of course, limited numbers in visits based on the facility. Limited movement. We don't want people wandering the halls at a nursing home who are visitors there and might end up walking down the hall in a unit that may have 2 or 3 COVID patients who are still in quarantine there. So in medium or high positivity counties, we encourage a test. Our CDC encourages testing visitors. But also, we want to make sure that people who are in a need for some compassionate care visits, and many times we associate these compassionate care visits as visits for people who really have end of life. They're at a point where they need to go ahead and have someone come in, and the family needs to be there for both parties again. All right. Now then, we had some newer guidance that was sent out, and we know that, do you remember seeing this? This has just been since about the 20th of March. Let me back up. I don't like that fraud slide. Since the 20th of March, things have been relaxed, and people can go in and finally I can hug my grandma, and so nursing homes have relaxed their guidance and their ability for people to come in. We still, of course, want people to be very careful, and especially of what they're taking into the nursing home as well. So, we want to just stay on top of that, but we do know that visits now in nursing homes are becoming a priority for the patients there, so, and the residents. All right. Fraud awareness, we just need to know there are some fraud examples here. COVID-19 has just opened up all kinds of new opportunities for that. So fraudsters are advertising tests and grants to people, fake grants through the Department of Health and Human Services. Prescription cards, you can get one of those in exchange for personal information. Come and get this prescription card and you can get your COVID-19 vaccine for free. I just need to know your personal information. Well, fact check. Everybody gets it for free. These services are unproven, they're illegitimate, but people, during a time like this, it's high stress. They'll try anything to make sure that they're going to be safe, not always thinking that the other person does not have their best interest at heart. You're not going to be asked money to get a vaccine. Always unsolicited calls or texts with people wanting your personal information you want to watch out for. Make sure that if you get a test, that it's a legitimate site and not some place that is not legitimate. Look at contact tracers. If scammers call and say, I'm trying to, trace everybody who was around a person, and I need your Medicare number, or, whatever. Those are always times when we need to be very, very, very careful and encourage others as well. All right, I kind of flew through those slides, but I'm asking for questions here, so be sure and keep those in your chat box for right now. Isn't that right, Ray? We want to go ahead.
Yes.
Okay, all right. So now Ray has got some slides to talk to you about, and thank you so much for your attention.
I do. And Gaye, if you wouldn't mind advancing the slides for me, that way that'll save us some time.
Okay. All right. What did I do? Go backwards on mine. And yours are
Go back where you were. Mine are attached to yours. Oh,
no,
they're not because you changed it. Let me get the ball. Can you give me the ball, Gaye?
Yes, I'm sorry. Yeah.
All right.
Okay. I think you've got it, Ray.
Okay. Now, I'm still seeing Gaye.
Is your whole screen?
Yes, ma'am.
Okay. Let me do this.
Well, now I see Gaye Humphrey.
Ray, do you see this share button on the bottom of your screen?
There we go. All right, yes. The answer is yes.
Is it going to pop up when you click on it? It should give you the ability to share your PowerPoint.
Okay.
There you go.
All right. Are you guys seeing the PowerPoint now?
Yes.
All right.
Now you can go to, let's see, you can go, there you are. I'll be quiet now.
Okay, good deal. All right, folks, Ray Walker, glad you guys could join us today. I wanted to touch base with you on some of the scams that we're seeing. As you know, along with the SHIP program here at the Oklahoma Insurance Department, we also have the SMP program, the Senior Medicare Patrol, which deals with looking at the different scams that are targeted toward Medicare beneficiaries. And it was sadly amazing how rapidly these scams cropped up related to COVID-19 when the pandemic hit. In fact, the very first scam related to the scheduling of an appointment to get the vaccine actually occurred a month before we even had an approved vaccine. That's how rapidly these scam artists got about the process of doing this. So let's take a look at some of the information related to these scams. As far as who these people are targeting, it always seems like they're aiming at senior citizens and stuff, but let's take a look at some of the information as far as why this could possibly be. When we look at the pandemic and who it was hitting, we know that people who had end-stage renal disease had one of the highest rates of hospitalization when they were diagnosed with COVID-19. The same was true with people who had several severe chronic medical conditions. A lot of those people then, we know, were on disability, which also means these people were eligible for Medicare. And then also, as we know, people who are older and eligible for Medicare, they're also at higher risk. So that's what these scam artists were actually noticing was, hey, we can hit Medicare, which has very deep pockets, very hard if we just target this population that's Medicare eligible and really not have to even get into the other insurance products. And so this is one of the reasons why it also makes people who are Medicare eligible a very valuable ally in this fight. That's why we want people who have Medicare to be very knowledgeable about the things they need to be watching for in terms of how they can spot a scam and help us to fight this issue. One of the other things that it's kind of interesting to point out, now I'm having trouble getting my slides to advance. Let's see if this button will work. There we go. Is you'll recall a couple of years ago, before we had a pandemic, we talked a lot about the genetic testing scams. You know, we had these people that were going out telling people that they could give them a genetic test that would tell them what their risk was of developing cancer. And this was, of course, a scam. And we looked at a map of what were the states where we saw the most reports of this genetic testing scams being reported. And of course, we saw California, Florida, New York, places like that. But we also saw a few other states that you wouldn't necessarily expect to see, like Iowa, Louisiana, and some states like that. Well, they've done a similar report looking at the reports of COVID scams. And guess what? The exact same states popped up on those. So what that tells us is the same entities that were perpetrating the scams related to genetic testing are also guilty of doing the COVID-19 scams. They just simply shifted gears and started working on these other scams, which is a shame. So now let's look at some of the actual scams that we're seeing. One of the ones that we want to make sure people are very aware of now that a lot of people have gotten their vaccines. And so now we're thinking we're going to start seeing people who are supposedly doing surveys. They're going to contact Medicare beneficiaries and say, you know, we just want to see how you reacted to the vaccine. We want to see if you've had any side effects and that sort of thing. And so they're going to be reaching out to people via Facebook, maybe through mailers or whatever it is, saying that they're just doing this survey and, you know, you can earn money if you'll just help them out by responding to this survey and answering a few questions. In some situations, they may not offer money to answer the questions on the survey. And what you want to look for on that survey is, are they asking any personally identifiable questions? Are they asking information like your name, date of birth, Medicare number, any of that stuff that you really shouldn't be giving out on a survey like that? The other thing you want to watch for is some of these surveys are offering money. They're saying, hey, just for your time, we'll pay you a little bit of money. It may be $25, it may be $50. Some of them are offering over $1,000 if you'll participate in this survey. Where the catch is there is they're going to get to the end of this survey and they're going to say, now we want to pay you, so please give us your banking information so that we can wire this money to your account. They're not going to wire money to your account. They're going to take money out of your account. So you want to watch for those things. There may be an actual survey that's going to be done. We know for a fact that the CDC is doing one, and you can access that survey at cdc.gov. But be very, very careful about what surveys you do respond to. If you choose to participate in a survey, always be very cautious about the kind of information that you're offering in that survey. Don't give out any personally identifiable information. So some of the scams that we've seen during the pandemic, one of course was the head of the line scams. That's where people were contacting seniors and saying, hey, we can put your name on this list and we can bump you to the head of the line if you'll pay $50, $75, something like that. There was no such thing. There were no head of the line scams. Again, they were just trying to get your money, get your credit card information and things like that. Also, the scheduling vaccination schemes, there were legitimate scheduling processes that people went through their local health department and places like that. But unfortunately, some people grabbed onto that and they were contacting seniors and claiming to be assisting them when in fact they were actually just getting their information to use to access their Medicare account. The pop-up vaccination sites, we didn't see a lot of those. This is more of a be careful of announcement than it is we saw a lot of these. We did see these pop-up sites with the genetic testing scam, and that's one of the reasons why some of the consultants and people that we work with on the S&P project said, be aware of, we could conceivably have some roadside places that pop up that say, hey, you can get your COVID vaccine at this place. And the scary part about that is you really have no way of knowing what are they vaccinating you with at these sites. So not a good idea, folks. You really want to go to a place that you know for a fact is giving a valid COVID vaccine. Pay attention to what your local news is telling you as far as where to go to get those shots. Talk to your doctor's office. Go through your health department and places like that. Don't pay attention to somebody that's spinning a sign on the side of the road unless they're spinning the sign next to your local health department, and then go for it. But just be very, very cautious about where you're going to get that shot. We also anticipate that there could be some vaccine certification frauds, and people that are reaching out to you saying, hey, great that you've gotten your vaccine, but do you have your certification? Because it's going to be required for you to travel anywhere. You've got to have your certification, and they may come up with some story about some form that's going to be required by the government for you to be certified. And, most people have got their little card that shows when they got certified and stuff, but be cautious about anything that just comes up out of the blue on Facebook, a telephone call, or anything like that, where they're asking for personal information, credit card information, your Medicare number, or anything like that. Again, if you've got any questions, you can always reach out to us, or you can contact CMS or your physician to find out more information if you think something might be a little bit fishy. Where is this fraud happening? Unfortunately, folks, they're using every method possible to reach out to people to get at you and to get your information. In-person fraud, yes, it could be someone that shows up at your door, but unfortunately, in-person fraud also includes where you've actually gone to, say, a doctor's office and maybe seen somebody, and during that visit, they may offer some services that really you didn't need, or during that visit, you may actually have received some sort of service, but when you get the chance to look at your Medicare summary notice, you may find that you've been billed for charges for services you didn't receive. That also falls under that category of in-person fraud. Texting, telephone calls. I've received some text messages trying to get me to respond to a message about concerns about the quality of my COVID vaccine and things like that, and they're not valid. If I was concerned about it, I would reach out to the health department or someplace like that to express those concerns and find out what was going on. Also, in relationship to that, I've gotten a few text messages from allegedly from Social Security, which I also know are a scam. But again, if I was concerned about it, I would call Social Security and talk to someone there about that. The internet, folks, it's a great tool. Facebook, it's a lot of fun. Be cautious about the things that you're clicking on there, folks, to get more information because, again, they could be a scam. And as always, what you get in the mail, be very, very careful about what you respond to and what information you're giving out. The other thing that we've noticed, as Gaye pointed out, there are some people who are hesitant about taking the vaccine for one reason or another. And unfortunately, the scam artists have caught on to this as well. And so they've been advertising alternatives to the vaccine. And some of the ones that some of our consultants have pointed out to us that they've found are, one is a toothpaste, which cures COVID. Isn't that a miracle? Another was a foot bath that would cure COVID-19. And isn't that fantastic? Unfortunately, there was another one that was a lanyard, one of those things that you put around your neck. It actually contained a rather hazardous pesticide that I believe is even banned here in the United States. I'm not sure about that, but it was actually somewhat dangerous. But people could actually buy these products online, and they're being led to believe that it's going to do the same thing as the vaccine. And folks, that's unfortunately not true. So don't fall for those scams. Don't let somebody get into your account or trick you into using this stuff. Pandemic-related supplies and equipment. Again, this is another area where they're going to try to get at your money. The N95 masks. These have been huge scams. The state of Texas actually got caught in a scam where a company was, alleged company, was offering a really good deal on some N95 masks. And as you can imagine, as a state government, Texas probably went through a lot of these, and they were caught in a situation where it was a fraudulent advertising situation. So be very cautious about responding to any online advertisements for supplies like masks, syringe, gauze. That also applies to those individuals who do use any kind of DME items. If you do use catheters or any other supplies, make sure you're going to a reputable supplier for those type items. Be very, very cautious about what you are replying to. Gaye also mentioned about the fact that now, as a result of the pandemic, they've expanded telehealth services, and that's really great. That's very, very useful, particularly for those folks who live in the rural parts of our state. Just be very, very cautious. Continue to rely on those healthcare providers that you know and that you know are reputable. Beware of any ads for any telehealth services from companies that you don't recognize and that you can't verify. Sometimes these people will use the opportunity to get you online, have a brief conversation with you, and then they may recommend, based on what they've evaluated you for, that they now want to come to your home and do further evaluation. And during that evaluation, they may take that opportunity to get more of your personal information, or they may suggest that you need equipment that you don't necessarily need. So again, be very, very cautious about who you're giving your information to and who you're trusting. Always reach out to those local resources. Contact CMS if you want to verify somebody's credentials to find out, if somebody really should be in your house. All right, so we're going to stop talking here, and I'm going to pray that I can figure out how to get out of this view and see.
You should be able to stop sharing.
All right.
And if it disappears, you can drop down from the top normally or the bottom.
I'm just trying to figure out how to expand the darn thing.
Sometimes if you take your mouse to the top or the bottom, it will pop up. Your content control bar will pop up or pop down. But regardless, I love the black screen.
Oh, great, because
That's okay. The COVID foot bath and lanyards were new to me. So
yeah. So do we have any questions that we need to answer while I'm trying to play with this thing and figure out what I'm doing wrong?
We had one question for Gaye. I'm not sure if it's one she can answer or not, but it was a question about how long to wait between, I don't know how to say this, Shingrix, is that how you say it? And the COVID-19 vaccine.
All right. I don't know the answer to that, but I can certainly find out. If is there a contact email address or something
Yes,
there?
I will get that to you.
Okay, that's fine. I'll look that up. I hate to give medical advice, even though, I've watched plenty of TV shows about it. But I'll certainly get the right answer for you.
Okay. Ray, can you go over a few of the commonly asked questions that you have?
Absolutely. But before I do, since we've got a few minutes, I did want to talk about on Monday, April 12th, that is Senior Day. Most of you are probably familiar. We used to have Senior Day at the Capitol. Well, of course, we're getting vaccinated, but we're still distancing. So we're not going to do Senior Day at the Capitol, but we are going to have Senior Day. It will be this Monday. It's going to be from 10:30 a.m. to noon. It's going to be via Zoom. It's sponsored by the Alzheimer's Association and the Oklahoma Aging Partnership. And Governor Stitt's going to be speaking, as well as some other individuals. If you would like to register, you can call 405-943-1895. I'll give it to you again, 405-943-1895, and you can register for that event. So that would be a good opportunity to kind of learn more about what's going on with seniors, what's happening at the legislature, and that sort of stuff. As far as questions, Gaye, people are reluctant about getting the vaccine. Are we hearing a lot about any adverse effects? It's kind of like you said, when I got my shot, and I'm glad that I did, I had muscle soreness, but that was about it. I really didn't have any other adverse reaction to the shot. I haven't really heard anything else on the news about it as well. Is CMS reporting anything that maybe you could talk about?
Well, CMS has not come out with any kind of report, and as you said, sure, there are going to be people who have a severe reaction. And you might remember when the vaccines were first released, there were a couple of people who, got their shot and passed out right there, or, something like that. But no, we're not seeing a huge number of people, having those reactions. And my guess is, we don't want to give bad press here, and so we have not seen guidance from that, from CMS. But I'm not hearing it on the news, anything like that. So,
What about people with any underlying medical conditions? Is there any specific medical conditions that a person might have that they shouldn't get the vaccine?
well, I'm sure this happened to you as well. When I got my shot, they asked me several, are you diabetic? Or I can't remember the questions they asked, but they asked me about conditions that maybe the vaccine would interact with not well. And so, they do that screening just at the, at the site when you get your shot. But you also just might, call your doctor and say, are any of my conditions something that might preclude me from getting the vaccine?
Okay.
But that's part of the effectiveness tool that they use in looking at the vaccine is what are the side effects that we're seeing, and they by law they would be required to certainly say that.
Okay. All right. Well, folks, thank you so much for joining us today. We really appreciate you joining us. Wanted to remind people that we're going to be having our fraud conferences. Hoodwinked is going to be starting in May. To register for those, that site will be coming up shortly. You can go to oid.ok.gov to get more information about that, and we'll be doing some more advertising and stuff soon, and we hope you can join us. We've got some speakers from the Attorney General's office, from the Oklahoma Bankers Association, and folks that are going to be joining us. And I believe Social Security is also going to be talking about some of the scams that they've been seeing, particularly during the pandemic as well. And we hope that you'll take some time to join us for those. So thank you very much. And this concludes our webinar.
Thanks, everybody.